Good evening and welcome to Leading the Way right here on MaiTV. I'm your host Jacquee Speight, and tonight we have the incredible honor of meeting Dr. Asena Tuiketei, a dedicated pediatrician and woman who wears many hats. Dr. Asena, thank you so much for being with us this evening.
Thank you very much, Jacquee, for having me.
Could you tell us a bit about yourself? Let the audience know, who you are, where you're from.
Sure. Bula family. My name is Asena Tuiketei. I hail from Tombola Kemba in Laos, and I have maternal links to Aravundi Levuka of Laos. I started my journey as a pediatrician when I graduated from med school way back in 2007. Since then, I've worked in the 3 divisional hospitals all over the country. I've done a bit of locum work around the Pacific, and now I'm based here in Namaka in Nandi. Personally, I am married with 3 children, so I understand firsthand what it is to have the joys and challenges of raising a family and also being a woman in business.
Of course. So Dr. Asena, could you tell us, did you always know you were going to go into pediatrics, that you were going to be a pediatrician?
Yes, Jacquee. I knew from high school that I wanted to be a pediatrician. There was no other second option for me.
And what sparked this, this desire, like this, I'm going to do this, and this is what it's going to be?
Over the years, I've realized that I like working with children and that I want to be a doctor. So from a young age, I knew that, to combine the 2 passions, I would have to be a pediatrician.
So when did the idea come about for you to open up your own clinic and, all your family's in Suva?
Yes.
You could have opened it in Suva, but you chose to open in Nandi. What motivated you to just come up with the idea of, that's it, I'm going to Nandi and I'm going to open my clinic?
So I've been in the western side for some time. Right. I attended primary school here, secondary school here. My husband has maternal links in the Western Division as well. And we like the weather, the pace of life here. It's a good place to raise a family.
Oh, absolutely.
So we decided a few years back, to settle down and call Nandi home. So we have a home here, and it just seemed natural after that to have our business here as well.
What were some of the challenges that you faced when opening up the business, and how did you overcome them? Are you able to share with us some of the professional challenges or personal challenges that you faced?
Thank you. That's a very deep question.
Yes.
Yes. So first of all, it was the financing.
Right.
Financing in opening up this clinic and getting the appropriate equipment that I would need to enable me to provide service without breaking the bank.
Right.
Second thing is location. Where in Nandi would we open up? And we were fortunate enough to link up with my colleague, Dr. Sailasa, who invited us to share this office space. So we have 2 individual businesses running and sharing the cost of this office space here. Thirdly, it would be establishing the brand. This is something new. I'm new in this private sector, new in this space. So establishing a brand is something that is ongoing and something we are working hard towards. And then it is also getting involved. So I would still want to be involved in the pediatric community where I continue to stay up to date with the latest practices while I weave myself into the community. Yes.
So when it comes to finances and starting up a business, did you already have money saved up?
Yes and no.
Did you go to the bank, apply for a loan? Did you get funding from an institution? How did that all come about?
So that was, the finance bit is just my husband and I just deciding this is something that we would want to go into, and this is something that we would prioritize as a family, as a couple. And we decided to put our finances from our own personal income that we've put aside and saved over the years, and that's how we've opened up and established here.
I feel that's so empowering for you, that your husband has supported you through this, you know, that he invested in it.
Yes.
I feel like that doesn't happen too often in many other places, but you've been empowered on your own and then with him as well.
Yes.
Being able to open up the clinic.
Yes.
So the other thing you touch base on is that you've been promoting yourself. How have you been doing this, or how do you go about promoting yourself?
So first of all is mindset. I had to change my mindset because I prefer to be in the background. I do my job well when I'm in the background, and whoever needs to be in front just continue and do the work.
Yes,
so
I can
first of all
that.
was change in mindset, that this is something that I have to do, something I have to get comfortable with, continuously coming out of my comfort zone into areas that I have no experience in, and just coming out and getting on with it.
Yes.
My husband has been the one who's mainly pushing me. He's the one who's usually out there and doing things.
Yep.
So knowing that he has my back in this,
you have your support system, and that's so important, especially on this new journey.
Yes.
You know, running a business, getting things done.
Yes.
And that brings me to my next question. Your work-life balance. You wear many hats.
Yes.
You're a mother, first and foremost. You're a wife. You're a daughter. You're a sister. You're a friend to many.
Yes.
You're a pediatrician, and now you're a business owner.
Yes.
How do you balance it all? Just take us through, before you answer how you balance it all, just take us through what a normal day would look like for you.
A normal day before I had the clinic, or
before you whichever, but you know, now that you have the clinic, how does a normal day look for you?
So for me, I have more time at home, so I'm able to wake up early, have some time to myself.
Yes.
I can spend some, my time with God. Then I go on to the family. I have time to get the children ready for school. Then I drop them off to school and I come to work.
Right.
So when I'm at work, I'm here, and then end of the day, I try to make it back in time for school pickup, and then we are back home. Yes.
And could you do this before?
No, I wasn't able to do this before. So that is something that I enjoy. Yes. And other things that have helped me be effective and to wear all these many hats is prioritizing self-care.
Yep.
So this is something that I've always thought of and kept at the back of my mind for me to do, to prioritize self-care. But ever since starting this clinic, I have made it my business to prioritize self-care, which includes having some kind of physical activity.
Yes, that's so important.
Trying to choose the healthy option. Yeah. Having enough sleep, and actually having a hobby to help me debrief and de-stress at the end of the day.
Wonderful. I think we all could take that advice, is finding an outlet. We all live such busy, stressful lives. I too live such a busy, stressful life. It's just that reminder that we need to take a step back and find time for ourselves. Anyways, before we continue, we're going to go to a quick break right now, so please stay with us. And when we come back, we're going to carry on our conversation right here at Pacific Babies with Dr. Asena Tuiketei. Good evening and welcome back to Leading the Way. I'm your host, Jacquee Speight, and tonight we have the wonderful and incredible Dr. Asena Tuiketei, business owner of Pacific Babies right here in Nandi. Doctor, thank you so much again. And moving forward, the main question, one of the big questions I meant to ask you earlier is, did you always know that you were going to open your own business?
Not at all.
No?
All I knew is I wanted to be a pediatrician, and that's it. And then as time went on, my priorities changed. I wanted more family time. I wanted more time at home, And I think things just culminated in the recent passing of my dad.
Yes.
So I wanted more time with him.
Yeah.
And that just helped change and shift things
Your
into
whole perspective.
Yes, and that's how my husband and I came up with this idea of having our own clinic and being able to have something that we don't have often, which is time, making time for family and being in charge of our own time to do whatever it is that we want to do.
I love that you recognize that in that moment and you acted on it. And look at what you have now.
Yes.
You know, and I love that you have, it's something that you've mentioned in the, you know, when we were speaking earlier, just time. Time is so precious.
Yes.
You know, and you now have that time because you've made it a point to make that a priority for you and for your family.
Yes.
How do the children feel now that you have, you know, all this time with them now at home?
Oh, they are happy.
Yeah.
They've always asked me to pick and drop them from school. So now I can do that.
I love pickups and drop-offs.
Yes.
Do you enjoy the pickup and drop-off?
Yes.
I have a number of friends who are not into it. They can't stand the lines. So now when it comes to your clinic, you didn't have any plans whatsoever. Was there any thought of, should I open it in Suva? Should I open it in Lautoka? Or was it just, did you recognize something in the Nadi community that made you decide, you know what, I'm just going to set up clinic here?
I realized that there was no pediatrician in Lautoka in the private sector. All of the pediatricians are based in hospital, and there are layers of health care that people need to go through before they access a pediatrician. So this was something that I thought would be good, where you can just call somebody directly and you would have the information and the help that you need. So easy access was something that was important. And finding the location too was also important, location where people could come, and the location to also be affordable for us as a company.
Right.
Yes. And so that's how we came about, and that's where we are today.
So now that you're a private practitioner,
yes,
are there things that you are doing differently with regards to your approach to treatment compared to how it was when you were working in the public sector?
Again, time. Now I have more time to spend with my parents and guardians who come in. I can explain things to them. I disseminate information and help them make informed decisions about their children. Yes.
And that's, I take it that wasn't something that you had before.
Yeah, it was there, but not as much as I would want to have. So that is something that I enjoy doing more now, and I can make time for it.
That's wonderful. Are you able to share with us a role model or a mentor that you had either before you joined medicine? Is there someone that you looked up to, or is there someone who inspired your work even more during your the last professional years for you up until now?
So growing up, we would always be asked the question, what do you want to be when you grow up?
Oh, we all get asked that.
Yes, and I would always look around, and as I got old, I realized I would choose to be the person who enjoyed doing what they loved doing. So it was the taxi driver, it was the cleaner that I saw who was happy, it was the waitress who served us whenever we go out, and they looked happy doing that. So that was something that was important to me, to do something that I enjoyed doing, something that I would do day in and out, something that I would even do for free. Yes, and when I joined medicine and went into pediatrics, we had a lot of mentors, our seniors who were there, and they all had their different passions about certain parts of pediatrics that they enjoyed, that they loved doing. So that I would pick and learn from each one of them. We had local mentors in the hospital. We had visiting specialists who would come over from different countries, different specialties, who would come and impart knowledge, improve our skills. And we also had people coming in who would mentor us and guide us and provide that safe space where we could discuss the complicated cases, ethical considerations, and the challenges of being in this profession.
How important do you think it is in the medical, medical profession for aspiring, women medical practitioners? How important is it for them to have mentors, to network?
Yes, it's very important because we cannot do this alone. I believe anything, especially in healthcare, we cannot do anything alone. Every doctor has something that they are passionate about, and we cannot address that health issue alone. It's too big for one person. So finding a mentor who would guide us and help us achieve things, give us some career advice, help us to maintain that work-life balance is important.
There you have it, ladies and gentlemen. Stay with us, because after the break, we will continue this discussion with Dr. Asena Tuiketei right here on Leading the Way on MaiTV. Good evening and welcome back to Leading the Way right here on MaiTV. Tonight, in case you missed our earlier segments, we've got the wonderful and very beautiful Dr. Asena Tuiketei, owner of Pacific Babies Clinic in Nadi, here with us tonight, telling us about her journey, about her business, and now we're going to learn a little more about personal motivation and support system. Can you tell us a bit about the type of support system that you have and how important it has been for you in your journey, in your medical profession up until today?
I would classify my support systems into personal and professional.
Of course.
So personal would be my husband, my family, my sister, my mother, and my children. They are very supportive. I've learned I have to communicate expectations clearly, and planning is important. Professionally, I have a few colleagues who are there who are also venturing out into the private sector and trying to keep up to date with the current trends in pediatrics, the changes that are there, and also staying relevant to what is happening around us.
What are your goals for your clinic over the next, say, 5 years?
So our goal is to focus more on preventative care. Right. So we run baby clinics and we run mother's clinic here. We understand that our children come with their families. So if a child is sick, we have the capacity to also look at the other children and the adults that bring them into the clinic. Another priority for us is developmental assessment.
Yes.
So we have seen that there are children with developmental delay. Some are simple, some are complicated, and we are looking into screening, catching them early, referring them on to other specialized care or early intervention for these children. And we also prioritize community work. So we've started some community work here with our local church, where we provide a free pediatric service to the children, and we give feedback to the families that if they would like more evaluation, then they come in for that. And we are always looking to partner with people who are interested in doing community work around the Western Division.
That's wonderful. What has the response been like? Since you've only just started recently, you're very new in the area.
Yes.
What has the response been like, and how do you get the word out?
It has been very good. We've seen an increase in our numbers of patients and families that are coming in.
Yes.
We are getting referrals, not only in person, but we also do e-consultation, so they are calling in and making appointments with us.
So they don't need to turn up?
They don't need to turn up.
They can call in?
Yes.
Viber?
They can call in, they can Viber, email, we book an appointment, and then we would see them online. And of course there are, you know, disclaimers and papers to go through before we finally see each other.
Yes.
But yes, that is a service that is available.
That's amazing.
Yes, and we also want to empower parents. So we have a few courses that we'll be putting out online. Our first one coming up is the breastfeeding classes.
I saw that online.
Yes.
And
so,
I mean, I'm not a new mum or anything, but I was so excited to see it.
Yes.
Especially for new mothers.
Yes.
You know?
We want it not just for the mothers, but for their support person. So, you know, their partner or whoever it is that will be there in their journey through pregnancy, delivery, and onto the breastfeeding.
How has the response to that been?
It has been good. So we had put out feelers first, and it has been very positive. So we should be launching that soon.
That's amazing.
Yes.
Dr. Asenna, do you have any advice for aspiring female entrepreneurs?
Oh, yes.
Especially in the medical field.
Yes. So in the medical field, it's something new that I've come to learn, where we are blending care and commerce. So we have to be in that intersection where we are managing our patient care, but we also have to manage the daily operational needs and financial needs for the business.
Yes.
For our women entrepreneurs, especially those in the health sector, I would say believe in your vision and in your value, embrace your authenticity, always look to increase your knowledge and learn new things, prioritize self-care, and as you rise, advocate not only for yourself but for others as well.
Wonderful.
Yes.
Thank you so much, Dr. Asenna. Now I'm inspired. Who knows, maybe 10 years down the line I'll join pediatrics.
Yes, sure.
I'm not too sure as what exactly, but we'll figure it out.
Yes.
Thank you so much for being on the show tonight.
Thank you for having me.
I truly appreciate it, and I wish you all the very best.
Thank you so much.
Vinaka. And there you have it, ladies and gentlemen. That's all we have for tonight. Our wonderful episode with Dr. Asena Tuiketei, owner of Pacific Babies here in Nandi. Now, if you'd like to reach out to her or find out more information about Pacific Babies, you can do that through her Facebook page.
Yes, we have Facebook, we have Instagram, and you can call us on 7210-234 or email us at pacificbabies123@gmail.com.
Vinaka. That's all we have for tonight. Be sure to join us again, same time, same place, right here on MaiTV.